Are you rolling?
Mm-hmm.
All right, Dr. Kaplan here from Home Degree and Wellness. I'm about to perform a PRP injection of my own hip. I had a labral tear on the same hip about 12 years ago and did a PRP injection on myself with ultrasound guidance. I had complete relief of pain for about, like I said, 10 to 12 years, and recently started feeling aching in my hip again. Recent MRI showed a little bit of arthritis, and then yesterday I went for my run and then had a lot of pain in the groin, which felt very much like the original injury. So we're going to go ahead and repeat this PRP injection. This time we're going to be a little bit more sophisticated. We're going to use a PRP that we added SuperShot to, which extracts stem cells from the plasma, so it makes it more concentrated. The whole solution is ozonated, and that's right here. And then we also are going to combine it with my fibrin extract, which creates a little clot, which helps PRP stay longer in the labral tear. And then we're going to finish with fiberoptic wires, and we're going to irradiate the whole healing solution with red and infrared light for about 10 minutes, which is going to kind of seal the deal and complete the healing process. So we're going to start injecting. I'm going to start by, I sterilize the area. We're going to start by putting a needle in, and I'm going to introduce a little bit of numbing solution through the needle. And I'm slowly guiding right to the labrum. You may want to look at the ultrasound. You could see the needle going through. A little bit of motion. Okay, and there it is. There's my needle. I'm right at the labrum. Right at the labrum, at the junction between the hip and the socket where the labrum is. So I'm right in the right spot. You can see the movement of the needle right here. I'm numbing right now. And then we're going to pull out. I'm going to numb as I pull out. And then we're going to introduce these special needles that are for fiber optic wires without touching the needle and keeping things sterile. Oh, can you touch the screen for me? Just touch the screen because it kind of went frozen. Good. So this needle is a little different. Okay, there it is. There's my needle going in, right to the labrum. Good, boom. One more. So the reason why I'm doing 2 needles is because we're going to introduce 2 lasers into the area. One is going to be red, one is going to be infrared. You can see the second needle going right in. You see the needles on the screen there, on the ultrasound? Okay, all right. So now I'm going to unscrew the tips. By the way, don't try this at home. Okay. And then we're going to start the PRP injection. I kind of want to watch it go in under the ultrasound because I want to make sure that it's flowing into the joint directly, not just on top or around. Okay. Okay, so let's see. Okay. So there she goes, going into the hip. Just want to make sure. Keeping an eye on the ball of their, there you go, the ball of the femur. Just want to make absolutely sure that all goes into the joint. I'm not wasting any of it. Okay. Again, just checking, making sure that it's going into the joint, not anywhere else. Okay, the last little bit, I'm kind of comfortable with the position now, so I need the probe. I'm going to combine with what we call a fibrin extract. This is going to create something we call PRF. That's going to create a little dressing type of a solution which will stay around the labrum and coat it. As soon as I inject, it starts to gel up a little bit, so I got to be pretty quick in the injection. It's going in nicely. Don't feel much because I numbed it. Kind of good to the last drop, so make sure it all goes in. Still just a little bit left. I'm trying to get it all in there. Okay, good, okay. And then the last bit, which we're going to attach to lasers in a minute, are these fiber optic wires. They go through the needle into the area where the PRP was just injected into. You can notice that using the no-touch technique, so everything stayed nice and sterile. Okay, and then we're gonna, if you can hand me those cables, the very two front. That one and that one. Yep, exactly. Yep. So no, right there, that's the that one. Yep. And just give me that one. I'm gonna attach it here. So one is connected to a red laser, the other one's connected to the infrared laser, and then we're going to press start on the machine. Start. Okay, now take a look here. So now you have red, the infrared is invisible, but the red's going in. Right where we did the PRF and PRP, infrared's going in this wire. I'm gonna sit like this for 10 minutes and let the lights activate the treatment. And then we're done with the procedure. Thank you.